Hi, everyone. This is Melissa Broyles from Athletico Physical Therapy. I am the Market Development Manager in Metro Detroit from Michigan. Today, I have the wonderful opportunity to talk with Dr. Nick Moore, who is a primary care sports medicine physician with Motor City Orthopedics in Novi. I also have Tony Green. He's a doctor of physical therapy at Athletico at our Commerce Township Clinic. I want to thank you both for joining me today to discuss the COVID-19 crisis and current options available for our patients as it relates to common injuries and options available for orthopedic care. We hope that this interview will help our patients during this time frame and answer a few questions you may have. Dr. Moore is going to start by answering a few questions about Motor City Orthopedics and how this pandemic has affected their practice. So thanks, Dr. Moore, for joining us. And if you could just sort of start to tell us a little bit about how the pandemic has affected Motor City Orthopedics.
Hey, Melissa. Hey, Tony. How you guys doing? Our office has stayed open. We have been calling and screening people. We've been, following, guidelines coming down from the CDC and the hospitals. So we've been screening people for infectious symptoms, and then we've been talking to people about, basically trying to have them only come into the office for urgent or emergent things, more serious injuries, other stuff. If we can put it off, we would. And then we're doing a lot of virtual visits for follow-ups and going over MRIs and things like that. So we've kind of had limited hours, but we've stayed open throughout the pandemic. We've had a lot of hospital staff that have gotten called, a lot of office staff that have gotten called into the hospital to help out, which has been good. They've actually all been, really enjoyed being there and being on the front lines and helping out. So it's been, I think, a good experience for people, but the clinic has been open for the most part. Surgery has been on hold for the most part, elective procedures, but still, emergent fractures and things like that are still happening.
Okay, so with your staff what are they doing in the hospital, or how are they helping? I was just curious, like what type of things they're involved in.
Depends what their role is. We have PAs that have gotten pulled in to do more, clinical things. We've had medical assistants that are, kind of operating as techs and doing some roles facilitating, for care. And we've also had front desk people that have gotten called in to be like the huck at the nurse's station, answering phones and triaging and things like that.
Mm-hmm. And Motor City Orthopedics is offering orthopedic urgent care during this time, correct?
Correct. Yeah.
Right. So Tony, at Athletico, can you tell us a little bit about how the pandemic has affected our clinic and our organization?
Yeah. Unfortunately, people are still getting injured. So we want to be there for the patients. So I'm still seeing patients in the clinic, and we're also doing virtual visits on FaceTime and Zoom, and just trying to keep the number of people in the clinic down, run a screening process, just so that people have an option if they get injured.
Okay. And so going back to Dr. Moore, and actually this question is for both of you, but I'll start with Dr. Moore. What type of common injuries are you seeing at the practice during COVID-19?
So, we're seeing a lot of the same type of things. I mean, we're seeing a lot of fractures. Again, I have an 8-year-old and a 6-year-old that are doing, in-house gymnastics and parkour and everything like that. So we're still getting some of that acute stuff. And I think we're seeing some adapting where, everyone's kind of turning into a runner and getting out and about. So we're getting a lot of those kind of overuse injuries as well. Still a good mix, but the things that are the most bad are, someone falls and has a wrist fracture, or, an acute shoulder injury. So those are the most common things that we're seeing.
I think at Athletico, I would say that we also are seeing those type of injuries and call-ins. And I'm sure, Tony, you might be able to tell us a little bit more about the types of injuries or types of patients that we're seeing during this time.
Yeah, with the springtime, I think, people are just getting outside more, working on the house, working on the yard. So we're seeing some shoulder strains, some back pains. I got a couple of new knee patients. That is until some of the elective surgeries are back on track. But yeah, just seeing some of the overuse stuff now that people are getting outside and enjoying their springtime.
Yep. Speaking of elective surgeries, Dr. Moore, so right now elective surgeries are postponed in Michigan. And so if someone is experiencing an acute injury, for example, they break a collarbone or an ankle, what kind of, what options are available at Motor City, or what are you guys doing for individuals who are calling in with an acute type of injury that may need more immediate attention?
Yeah, I mean, I think for the most part, you can kind of go by the same guidelines. I mean, you tweak your ankle or something. I mean, resting it, icing it, anti-inflammatories, all that stuff. I mean, just be cognizant of the same sort of red flag symptoms. If you're unable to bear weight on it, if you're having, a disproportionate amount of swelling, obviously, if you're seeing some sort of, abnormality, skin abnormality, skin tenting or something like that, that you're worried that there's more of an acute injury, then by all means come in. Like, we're here to help people. I mean, again, I think people are pretty apprehensive with how things are, but, us and most hospital systems and clinics are being pretty vigilant about following these guidelines, spacing out the waiting room, spacing out patients checking in. Some people are checking in from their car. Everyone's wearing masks. So for the most part, we're taking really good precautions and, have been able to be, as busy as, we need to for people. So please don't be apprehensive. We're here for you. Even if it's just calling us and letting us talk you through what we think you should do on the phone, like that's what we're all here for.
Really good information to hear. So as you know, COVID-19 has taken a toll on individuals who play organized sports, club sports, youth sports, soccer, baseball, rugby, a number of different sports, as we all know. Athletes may be struggling to find motivation during this time to stay in shape, to be disciplined in their practice. So I'm just curious, Dr. Moore, what recommendations do you have for athletes that you work with, or athletes in general, or teams during this time to stay motivated and trained?
So I think, we work with teams through the high schools. We cover some of the club teams. I cover the Detroit Roller Derby girls and the Detroit Rugby Club. Like a lot of them they're still, some of these club soccer, I know your kids plays for the Michigan Jags. I mean, a lot of them are still doing Zoom meetings and going over, game plans and, workout plans and stuff like that. I think a lot of these teams are just doing it just to connect. And I think that's a good idea.
I agree.
To connect virtually, my kids love this like house party app where you can play like different card games with grandma and grandpa and all this kind of stuff. So I think connecting is good, and the teams can be productive or just do it for camaraderie. So I think that's a good thing. I think, my big thing I've been telling people is to use this downtime. I mean, amidst difficulty, there's great opportunity. And so if you have, a season that was put on hold, maybe this is a time when you need to, look at your skill set and develop a new skill, or maybe this is a time when you need to strength train. We're all watching these, these Michael Jordan documentaries that's on right now. And like when they lost to the Pistons, he knew that he had to get in the gym and get stronger. And so this is an opportunity for people to get stronger or change their game. Or for some people, they just need to recover. Some people just need downtime and a little bit of time to recover. So, use this as an opportunity to improve your individual skill set. Tony you can't see it, but he's doing quad sets right now. You can't see him on the screen, but this is what he does. This guy never stops.
Well, I couldn't agree more. And I'm sure Tony actually had some physical therapy tips that he could provide for us during this time for athletes to return to sports. So Tony, why don't you share with us your suggestions and your tips?
Yeah, from a physical therapy standpoint, after a long break from activity and you're getting back into your sport, my biggest thing would just say, start slowly, just gradually build yourself up. Don't go out there that first day and screw up the rest of the season. So start slowly, build yourself up, and work towards that activity or that sport or that you're working towards.
I love it. I love you. Thank you, Tony. So many people are working from home and they're sheltered in place. And I know for me, I've been working from home and it's been tough. I'm in my role, I'm usually out and about. I'm talking with the doctors. I'm working in the clinics with the patients, and it's been like a new routine for me. So for me, I've created my own at-home gym, and I'm a runner. So I've been running 5-6 days a week for motivation to stay in shape. Um, I'm sure a lot of people out there may be doing the same, or maybe not sure. So I'm just curious if Dr. Moore, you can share with us some of your at-home fitness, for an at-home fitness routine, some suggestions and maybe a few tips for the average person to maybe stay in shape or to get in shape during this time.
Yeah, I think it's really important. Like you said, I think it's pretty important to keep your same routine. Even if you're getting up and going to the gym, you can modify and do that at home. I mean, I think we know physical activity has so much benefit just beyond that physical component to it. So it's a stress reliever, it's good for our mental health. So people, this is a crazy, stressful, anxious time. And so exercise helps that. So try to be active, even if the gym's closed and these other things. I think for some people, it can be, a time when you're bonding. If you have older kids, grab your family and go for a walk, get everyone together. If you're like me and you have 3 little kids and we're all in the house together and my wife is home and she's trying to figure out homeschool and everything else, and it's total chaos, her going out for a walk or me going out into the garage and working out is a little bit of a break or a stress reliever. So it can be, it can be either thing, it can be something that brings people together, or it can be sort of your alone time. I mean, some people like the camaraderie, and some people like, I like the challenge of a workout. It's an opportunity to push myself and I like to get up early in the morning and do something that, I didn't know if I was capable of doing it. That's a great way to start your day. So it's a challenge for some people.
Yeah.
I like to tell people to do something you enjoy. If you want to get into a sustainable workout regimen, it's got to be something you like doing. So, what are you into, and go from there. I like to tell people, like right now with the way things are, it's good to try something new. I just got a mountain bike. I live close to the park with some mountain bike trails. So I'm going to try to get into mountain biking. It's something different and something outside. My surgical partners are joking about who's going to end up fixing my clavicle if I fall.
Yeah,
and
you could be a patient.
but I'll be safe about it, and it's something different to do. It's
Absolutely.
good to sort of go and lean into the unexpected every once in a while. And so it's a great time to try something new. Yoga, interval workouts, biking, mountain biking. There's tons of opportunities.
Well,
the other thing I'd say is there's tons of programs out there. You can go on Nike or any of these like workout things, Facebook, all these people are posting, workout routines for in your house and interval stuff and Tabatas and, things to do. And so there's tons of resources out there. And, like you guys have the Athletico 5K, there's tons of virtual events that people are doing to use, sort of getting together and organize.
That's right. We just completed the Athletico virtual 5K challenge, and the proceeds go to help Feeding America, so for a great cause. The emotional and physical well-being roller coaster that we're all feeling around, it's very real. And exercise is medicine. It helps us with our stress. It fights off illness. And, we want to maintain a positive mental health. So I definitely appreciate your suggestions during this time and how we could use exercise as a form of healing. So Tony, over to you. If you could share with us too how exercise or an at-home fitness routine, like a couple ways to stay safe when we're doing this. So if you have suggestions from the physical therapy side, or maybe a stretch or two, or something that you would suggest to the average person that's watching this, that would be helpful.
Yeah, well, actually, good question. So when Nick called me and he was asking me how to get bigger calves and quads, I kind of dug around and I came up. I think the best exercise probably at home would be just some chair squats. They're really modifiable for your level. You can sit down on the chair, stand up, try a couple sets of 10. For someone on his level, he might want to try single leg coming up out of the chair. Really focus on the quads there. But it's modifiable to almost any fitness level, and it helps get those legs moving, keeps the legs strong while you're at home, and no equipment needed.
Yeah. And wouldn't you say that for people who are doing an at-home fitness routine, that one of the first things they should probably do is create a space and have like a designated area? I know Dr. Moore told me that his designated area is in his garage. And he has it all set up for CrossFit, and he brings the kids out there. I have a treadmill in my basement, and I have a whole area. So, I mean, I think when I have that space, it gives me that opportunity to either be by myself or involve my family, but it's my space to, take that time and exercise. So any suggestions on that end of it? It's just like a safe, anything that people can use for weights or different things within the home that they could use to create an exercise routine.
Yeah, sometimes I'll have people use a towel as a strap for stretching, different upper limb stretches that I have them do. Even small things like cans of soup, water bottles, or gallon jugs could be used for weights that are pretty safe. And if it's a nice day, get outside and soak up some vitamin D while you're working out too.
Absolutely. We're in Michigan, and we will take any amount of sunshine we can get. And definitely being outside is so important for that mental health. So I really want to thank you both for joining me today. The information that you have shared is very helpful. It's helpful for our patients. We want everyone who's watching this, our patients, the community, to let you know that we are here for you during this time, during this difficult time. Motor City Orthopedics offers both in-person and telehealth appointments, as well as Athletico. We really want to thank Dr. Moore for his time today, and also Tony for joining us and being able to share a little insight and tips for the average person. And so we really thank you again for taking this time. Any last words before we end the interview?
No, I just want to say thanks. It was super fun. And, we look forward to continuing to help people this way and moving forward as things start to improve, getting more people back in the office and getting out there in the community as much as we can.
All right. Tony?
Yeah, it was good chatting. Everybody hopefully out there stays safe and has fun.
All right. Take care, everybody. And maybe we'll see you on the next Athletico Zoom interview.